I hate to break everybody up because everybody's having such a great time, but it's after 3 for the HHS meeting, October 5th, 22. We'll stand and say the pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I'm glad everybody's here. I need an adoption for the agenda, please. Can I have a motion?
Matuzik moves.
Support, Nard.
Commissioner Matuzik made the motion, and Commissioner Nard supported. We'll take a vote.
It didn't come through. I'm sorry. I reprompted it. Motion passes 11-0.
Thank you. We're going to go to public participation now. This public participation is for those who want to speak for a maximum of 3 minutes on any item that's on today's agenda. There will be a second public participation at the end of the meeting, when anyone can speak on anything on that they would like to speak about. Does anyone want to speak? Once, twice, we will close public participation. We will go to department recommendations. Can I get a motion to recommend to full board A and B, please?
So moved by Nard.
Support Van Sickle.
Commissioner Nard made the motion, and Commissioner Van Sickle supported. We'll take a vote. Oh no, we just moved it.
We have to hear the presentation.
We haven't had the speaker yet.
Yes. Now, is there anyone here from the medical examiners? Yeah, there you go. Thank you, Andrew. This looks very interesting.
Good afternoon, Commissioners. Thank you for the opportunity. Yes, Medical Examiner's Office fortunately falls under the Health Department, so I'm up here to represent the request today for the purchase of a new X-ray machine. And this is something that has come to light. Our current X-ray machine is approximately 16 years old. It's come to its life. So everything, all equipment has a certain time frame, and it's definitely in need of replacement. This X-ray machine is not cheap. As you can see, we're asking for the purchase of the Lodox Radiology platform for the amount of $599,900. Would have been easier just to say $600,000, but let's be accurate with the actual amount. So this is quite an investment, but a needed one over at the medical examiner's office. This X-ray machine is critical in identifying cases and clients. This case that you're seeing here on display, 87 X-rays were needed when typically 15 to 20 X-rays are needed in a standard case like this. So we are now doing a lot more X-rays, potentially exposing staff, which are very good, but it's a risk. And we're also potentially missing perhaps something that's behind this interference bar, because as you can see, nothing is visible behind this. So this is very problematic. When the technicians were out to fix the machine, the real reason they were out there was not even this interference line. It was to replace a X-ray plate. just to refurbish it. It wasn't even a brand new plate. That cost was $16,000 to us just to refurbish to get it to this where it's at now. So we're pouring, really dollars into this old technology, old machine where we could really invest in a new machine in its time. We're fortunate through COVID dollars to save on personnel expenses at the health department through our nursing and CD staff through COVID grants. So we're able to utilize some of our unspent personnel dollars to purchase this. So this is ultimately a budget neutral ask, which I think is huge given the amount and the size of that purchase, that we could be potentially looking at doing this year and this calendar year. Initially, we thought we'd have to go through the budget process to do this. So it was in the budget discussions with Steve Smeagol in finance and the OCE's office that we were able to identify the ability to utilize funds now to perhaps speed this up and get this equipment into a much needed medical examiner's office to start utilizing this equipment. I'd be happy to answer questions, Commissioner.
Clearly you need a new x-ray machine. That seems clear to me. You're pulling $600,000 out of the personnel budget. What did we not do? Not hire? That's a lot of money to pull out of personnel.
It is, and normally that would not be possible. But this year's different because of all the COVID grant dollars that went to immunizations and also COVID contact tracing dollars. So it's the contact tracers that were reimbursed because of their work doing COVID that we were able to offset their personnel cost. That's why there was such a abundance of personnel expenses there.
So we got money to do things that we didn't do?
We got money to perform activities, COVID activities, with staff that we already pay for and budget for. They were already there. And we were able to offset with additional money that came in because of COVID that would normally not be there. So additional COVID,
Yeah, no, I'm
COVID
getting,
funds
yeah, it
came
just
down
seems to
from
me
the
like we
state?
double dipped on personnel.
No, because we had to charge. We do transfer sheets of the personnel time. So you're right, we can't double dip and charge people's time to two different funding sources. So we have to record how many hours they work in COVID clinics or contact tracing, transfer that out of our personnel county expenses, and charge to that grant.
All right, thank you, Madam Chair.
Thank you, Commissioner. Commissioner Kleinfeld.
Thank you, Chair. A couple things they did when they created the budget last year, and some of these departments knew that there would be a covering, but they kept the dollars in there. There's a couple of reasons to do that. The first is it throws the budget way out of whack for the following year, and if the board doesn't necessarily understand it, it could be catastrophic for the county. So the dollars are left in place so that the budget looks like that. I would assume that that's explains why our fund equity, which if you went back 5 years was projected to be a tough call, looks so absolutely fabulous right now. A couple of questions. I'm real curious, when was this put into our 5-year capital plan? When was this, how long ago was this plugged in to that 5-year plan?
I believe just this year, because the machine, it ran its course of life this year. It really deteriorated this year, and that was when it was identified.
So it wasn't in next year's plan until this year?
Correct.
And you've already had to replace an x-ray plate. So is this something that should have been identified, say, 2 years ago to be in the capital? The reason I'm asking is not just specific to this. What happens is if you look at our capital plan, we've talked about this for years, that it'll be this huge number and then it'll just flatline for the years further out, and we always know it's never going to be that. But things like this, I don't know if you can assume that they're, I mean, you can put them in and then delay them, but you probably had to know this one was getting to that point.
Yeah, it's a fair point, Commissioner, and I think it's a good one. We do this with other types of equipment and large purchases that we anticipate they have a shorter life, and I think it's easier to have that as a placeholder, I like to call it, in the budget for when we do need to replace it, being proactive. So we could have done a better job there, with looking at large equipment in the department and asking ourselves, what happens when this reaches its life and we have to replace this.
Okay. Thank you. Thank you, Chair.
Thank you, Commissioner. Commissioner Van Sickle, please.
Thank you, Chair. Andrew, this new machine, does it do digital imagery?
It does.
So will we save on materials?
The current one is digital as well. It displays. This is, as you're seeing, this is a digital image, so it's captured. So there wouldn't necessarily be savings there. What it'll do is, it'll save on the amount of x-rays needed. It also, this current machine, we have to manipulate the body to take the shots. This machine will actually take all the shots without any kind of manipulation. So you could argue that we could reduce on health risk to the employees of hurting themselves, workman comp claims. So you could probably argue that, but in terms of just paper files alone, we can't make that claim.
And the old machine, what happens to that? Does it go in landfill, or does it get traded in as part of the price, or?
That's a really good question. One I don't know, so I can get back to you on that.
There must be some value. There must be some value in it someplace.
We would have to. It's medical equipment. It's got a radiological source, so they're very. We have to register that machine, that X-ray machine, and keep track of it. So it's very regulated. That medical equipment.
If nothing else, that plate they just put in a little bit ago, you ought to be able to sell that back to the aftermarket or something.
That would be nice.
The last question is if we had 600,000 or thereabouts savings in personnel costs to our budget because it was covered by other funds, those people were doing other jobs other than what they normally do. What went wanting in their regular jobs?
So they were doing their normal job duties as a nurse. They were immunizing individuals, giving shots, although it was for the special purpose of COVID, which we got specific grant funding just for COVID immunizations, if that makes sense.
Okay, so now that we're not doing so much COVID immunization, are they sitting there waiting for people to show up to be?
No, so what we've done too is, in addition to, the staff, we had to have surge capacity staff. So we had temporary staff that we hired on. We've reduced those staff numbers.
Okay, that's sort of what I'm looking
down.
for.
Yeah.
Thank you. Thank you, Chair.
Thank you, Commissioner Farrington.
Thank you, Chair. Hi, Andrew.
Hi.
I'm going to go back, maybe beat a dead horse on what Commissioner Matuzak said, because you said the money's coming from the contact tracing group, and I understood that, but I don't understand it in the context of last year's budget season, when I made quite a big deal out of having to spend that money on contact tracing, and the response was, we can't allocate those dollars anywhere else. I see a shell game going on, I'm a little confused.
Yeah, so what we're reallocating is personnel, county general fund dollars that are set aside for personnel. We're not reallocating COVID grant dollars. The COVID grant dollars allowed the excess in personnel line. That's what we're moving out from county line.
But we then would have had excess staff and or monies that could have been removed from the budget at that time, knowing that the money was going to the contact tracing, and it could only go to contact tracing, supposedly. So there should have been an empty bucket that you're now using, but at that point you said you couldn't do it.
Right, in essence, I think what you're asking, would there be rollover of unspent personnel expenses this year if we're not buying the X-ray machine? The answer is yes.
I guess I'm more looking at how we did our budgeting last year. I think we were taken, so I'm just saying.
I don't think at that time we exactly knew what the amount of the COVID grants were going to be coming down when we went through the budget process.
All right. Thank you. Thank you, Chair.
Thank you. Commissioner Sabatini.
Thank you, Chair. Hey, Andrew. So, just to clarify this, you're transferring money from your personnel line item to a non-departmental transfer out, which will then go to the capital improvement fund so that you can purchase this machine. Is that correct, Steve?
Must be doing a terrible job, Steve, so come on.
Yeah, that's correct, Commissioner. The reason we're doing that as opposed to charging it directly to the health department budget is that we want to move the money to the capital improvement fund because we can't record the expense until we take delivery of the product, which will be after the beginning of the fiscal year.
Okay, so was this item in the 2022 capital improvement fund?
No, as Andrew indicated earlier, he initially requested it in his 2023 budget. We identified dollars that are available in his 2022 budget. We couldn't record we won't be able to record the expense in the general fund in 2022 because we're not going to take delivery until 2023.
Got it. Next question is for Andrew.
Thanks, Steve.
The price point on this machine, have we already bid this out? How do you know it's exactly that? Because I don't see anything except for a recommendation sheet here.
So we asked for, what we have in your packet is a sole source. So Lodox, the manufacturer, the only entity that they release and sell their equipment to is Great Lakes Imaging out of Madison Heights, and that's a sole source for this X-ray machine. And we got a 6-month price quote that's good until March of 2023 for that amount. That's how we came up with that amount.
Okay. Can we get that quote? Because we didn't. Oh, it is? Oh.
Thanks, Commissioner.
Thank you, Commissioner. Yeah, that's why it's tricky here, because I'm in the first item, not seeing everything that's in the second item. Okay, I'll review that, and if I have any other questions.
Thanks, Commissioner.
Thank you, Chair.
Thank you, Commissioner Kraft.
Thank you, Madam Chair. Hi, Andrew.
Hey, Commissioner.
Quick question. I haven't made it through the entire contract yet. Is there any sort of warranty or anything like that on this product?
There is. I believe it's a 20-year warranty.
Is that for something
it's
breaks?
Limited.
Okay.
It's a limited warranty for certain. We could get the language for you on what it, like a lot of large expenses, it covers some things, but it doesn't cover everything.
Typical. Okay.
Yeah.
Thank you. Thank you, Madam Chair.
Thank you. Commissioner Van Sickle, please.
Thank you, Chair. Andrew, the medical examiner's office that this is in is located where?
Right there. It's a building right by our Mount Clemens building.
Okay.
You're putting me on the spot now of the exact address, but it's right in between on the other side of Martha T. Berry.
Okay, thank you. Thank you, Chair.
I think we are good with speakers. I think we'll take a vote now, please. This is on A and B.
Motion passes 12-0.
Thank you, Commissioner.
Can I get a motion to recommend a full board for C?
I'll make a motion for 5C.
Support.
Commissioner Farrington made the motion, and Commissioner Wallace supported. Thank you. Hi, Ernest.
Hello. All right, well, I have a couple here for you that are pretty straightforward, and this first one is a big win for us. One thing you've heard us talking about over the last few years is our Emergency Solutions Grant. It goes to a lot of homelessness services. We were talking with MISHDA because one of the fallouts of all this pandemic funding was nobody wanted to use our Emergency Solutions Grant because it required a one-to-one match. We had a lot of people that usually received it, like Turning Point, the domestic violence shelter, and others, that Said, why would I take that money when the state's giving money with no match required? So we entered into a conversation with the state, and they presented us to an option by which the state would take our Emergency Solutions Grant, our ESG money, and provide a match for it, and then return it to our county continuum of care, where all of our homeless providers can provide projects that would fit the eligibility that HUD sets forth for the ESG grant. So this both saves the county some bureaucracy and saves us on some time, as well as it provides us that one-to-one match. So it allows more of our organizations in our county to take advantage of these dollars. While this wasn't as needed during the pandemic when all these funds were available, going forward, this will be a big win for Macomb County. I know with the millions of dollars we deal with, $160,000 seems like a small amount, but for our homeless services, that ESG is really an integral component of the funds we provide around the county. So that's what's going on with 6A and this first substantial amendment.
Ernest, does this deal with any immigrants at all?
Not well. It could deal with them if they're homeless. Right. We don't necessarily require people to provide proof of identification to receive those services. But no, not specifically. There are other grants that specifically deal with immigrants that are dealing with housing issues.
Right. I have a lot of people in the public asking me about buildings being built. There's no parking. They look like the rooms are being built for families. And they wonder if they're for immigrants that are coming over here that are not documented. So you have, when you put the immigrants in these places, you don't have anything to do with the documentation.
No, and this is not related to immigration and resettlement. The state has specific dollars available for immigration and resettlement. Obviously, the nature of undocumented immigrants is that they won't inherently be part of any of their state processes. Those are for documented immigrants, refugees, and those resettlements. And the state has separate dollars, and the feds have separate dollars for immigration, resettlement, and housing, which don't relate to our general homelessness provision of services.
All right, thank you. There are no speakers, so we'll vote, please.
Motion passes 12-0.
I think we'll go to D and E for Ernest. You want to explain those?
So moved. So.
I'm sorry. Thank you.
Yeah, the second one is a really exciting one.
Just a minute, please. I'm sorry. Commissioner Song moved and Commissioner Wallace supported. Thank you. Thank you, Ernest.
The second one is a really exciting one called Region Resilience. It's looking for innovations in food security. And we successfully applied and received $100,000. And what we're looking to do with this is to really supplement our food efforts. As you may know, I've talked a lot in the last couple of years about how food pantries have been the front line of defense these last 2 years. But what we've seen is, despite having over 70 pantries in the county, some are open in the afternoon, some are open in the evening. The one near you may or may not have availability. We want to explore more mobile delivery. And that's what we proposed for the Region Resiliency Grant. So we are partnering all the way up in Memphis and in Clinton Township and all the way down in Warren. So we're providing coverage for the entire county to provide mobile food delivery. We're doing that through partnerships with the Salvation Army. We're doing that with partnerships with Catholic Charities, who are blending other food service deliveries. We're using our interfaith voluntary caregivers. So this is really a test. That's why it's just $100,000 to test this out. That's what they were looking for. We heard that they are going to release a second phase of Region Resilience. And we even heard that the USDA is looking at funding further for mobile food delivery. We have a pantry called Mobile Missions that provides mobile food delivery, and we've really seen a need for that. The pantries are great. That is a necessary provision of services that Macomb County provides through our partnership. But this Region Resilience provides a lot of innovation. We're looking to learn how we could help reach people that are falling between the cracks and otherwise might not get the food.
Commissioner Farrington, please.
Thank you, Chair. Ernest, thanks. Obviously, this is needed, so I have only a related question. Do we have any statistics on the number of families in need of this food this year compared to last year, compared to 2 years ago?
Yeah, it's tremendous. And I will be presenting some of that information on our budget meeting, I think, in a couple weeks. But, you know, during the pandemic, we knew we were seeing a lot of that. There are a lot of Macomb County residents that were resistant to applying for public benefits. Conceptually, they were opposed. They thought it was too hard. They were facing barriers to apply. But a lot of people, regardless of whether they received public benefits, saw those food pantries as a ready source of support. Honestly, if you would have asked me in 2020, I would have said by 2023, that's going to be a blip on the radar. We'll be back to normal. And we're not seeing that. We're seeing about double the number of residents coming out for the food pantry assistance as they did before.
Do we have the resources to feed them?
We don't.
Thank you, Chair.
Thank you. Commissioner Matusek, please.
Thank you, Madam Chair. I think this idea of mobile delivery is a great idea. I talk to so many folks who don't have transportation, who can't get, they're sort of homebound, they can't get to the church down the street. I think this is a great idea. There are lots of hungry folks out there.
That's right.
And filling in all the cracks with the supplemental in the school nutrition program, the food banks, the distribution locations. I think this just adds another layer, and hopefully we can get to more people.
That's right. Well, and you know, it really provides opportunities for new partnerships. Catholic Charities of Southeast Michigan also has what's called Project Hope, which is a nutrition component just for people that have dietary restrictions due to a medical condition. So by partnering with them on Reach and Resilience, we're able to meet even more people that might have extra nutrition needs and deliver that food right to them.
I think it's a great idea. Thank you, Madam Chair.
Thank you.
Thank you. Commissioner Van Sickle, please.
Thank you, Chair. Good afternoon, Nurse.
Good afternoon.
I took Commissioner Farrington's question to be sort of count. I'd like to ask if you track families that are on this year after year, and is there any sort of counseling or referral to other services? Because this may be, well, there may be some other reason that they can't prevent, but it could be some reason that we could get to the root cause of it and help these people and give them a hand up out of the situation they're in so they can become more self-sufficient.
Absolutely, and I really appreciate that perspective. Due to the USDA guidelines, we are only allowed to request that a signature is provided. There cannot be an intake questionnaire to go to the pantry. That was something that the government felt was a barrier to receive services. But we do partner with them and provide materials like Macomb Community Actions materials, like others, so that they're promoted with those services. We can't do a full intake questionnaire to receive the food. We can just request a signature. But it's a great question about whether we could partner in a different way with pantries to make sure that people get a referral.
I read what you say that we can't require more information. Would it be allowable to leave a form and request more information voluntarily?
Yes, absolutely, and we do provide material there. The hardest challenge with food delivery in our pantries is staffing. These are volunteers at church pantries, mostly volunteers at community centers. They often have 2 people that might serve 100 people. So oftentimes in the past when we've requested that they maybe collect more, promote more, they say, if you have some volunteers that want to come down here and talk with people, we could do that. But it's not feasible for often a shoestring volunteer effort at a pantry. But I'll absolutely take that back to the team to see if there's a way that we could promote it better other than just flyers on a table, which is often what it is.
Yeah, because some people are just sort of in an endless loop of helplessness or whatever, and I'd like to see us try to give them a hand up out of that.
I really appreciate that perspective. Thank you.
Thank you, Chair.
Thank you. Commissioner Matusek?
Thank you, Madam Chair. It would be a great idea to include information from Cooperative Extension with their budgeting and helping people stay in their homes.
Absolutely.
That would be a great way to get them perhaps on a different track.
Yes, we do partner with MSU Extension on credit repair and debt counseling, and you'll hear more about that in a couple weeks. We're hoping to restart our IDA program to help people budget and get out of that cycle.
Thank you.
Commissioner Kleinfeld, I forgot that Commissioner Matusek had already spoken. Sorry.
No, that's fine. You're fine. providing information is one thing. It's a tricky slope to start requesting that they provide information as opposed to requiring it, because if that is a federal government rule, we don't want to jeopardize losing the funding. And we've got folks out in the field that aren't necessarily trained by us.
Yes.
And if they started requiring people to fill these out and somebody files a complaint,
Yes.
we're in trouble.
That's right.
So I would be absolutely in favor of providing them with information, not so much forms, because you're going down a road where we could be punished.
Yeah, it's a great point. When you rely on volunteers, quality control is a little bit harder.
If they got the forms in front of them, they're going to start telling people, I need you to fill this out.
Sure.
Thank you, Chair.
There are no more speakers. Can we take a vote, please?
Motion passes 12-0.
Are you doing another? Did you do your E?
Well, I don't know if you voted on E just now or not, but I can present E.
Yeah, we'll have to hear the presentation.
And E is pretty simple. This is just our standard CDBG allocation. The only thing for you to note in this one is you'll see that our allocation increased slightly, a small amount, but what you will see is that, well, it says that our award here is 1.868060. The total amendment is for more than that, because anytime we do our reconciliation, we're not just accounting our 2022 CDBG award, any prior years, our 2019, our 2020, and our 21, any HUD funding, whether it's the ESG funding or home funding, that's all included in that remainder. So we're receiving a slight increase of $1,868,000 in CDBG, and then you can see we have about $400,000 of other dollars that are still active in prior year budgets. So that's why you see those two numbers there. Other than that, it's just our standard CDBG allocation.
Motion to move the full board.
Well, we already did that.
Did we?
He just didn't explain it.
Sorry.
Yeah, we're all set. Thank you very much. Okay, thank you.
Madam Chair, I believe we skipped over D, which is what? All right.
Yeah, I should have made sure he's.
All right.
I'm sorry, it was my fault. I should have spoke on it, and then I caught it at the end. So, are we good?
So we didn't do an E.
Okay, thank you very much, Ernest.
Okay, thank you.
We are now going to go into community mental health. Dave? We're going into the budget. It'll be on page E4 if you want to follow down.
I'll make the motion to receive and file item A.
Oh, I'm sorry, receive. Thank you. Commissioner Kraft made the motion. Commissioner Wallace supported. Thank you. How's your day going?
Real good. Thank you. So far, so good. Let's keep it going. With me is Ken Melvin from our finance department, and he'll be going over the budget details. Some good news, some changes for the community mental health. About 2 years ago, 2.5 years ago, we received a federal grant to become a certified community behavioral health clinic, or CCBHC, so I can start throwing around all the acronyms right off the bat. That was a direct grant with the federal government for $3.4 million for 2 years. We said we could serve 3,000 people. We actually exceeded the 3,000 people. And what was interesting, it was really good preparation because we became part of the state of Michigan's demonstration project October of last year. So we've been running the demonstration project for a full year now. What is a CCBHC, you're asking yourselves at this point? It's an integrated health project. It was from Senator Debbie Stabenow, included it in her Excellence in Mental Health Care Act. And really it's to improve access to services. So we can now see under the demonstration project especially, we've always been traditionally in community mental health limited to people with severe mental illness. So when you called us for help, we had to ask you a lot of questions to make sure you met the Michigan Mental Health Code criteria as being severe. That's gone for us now since last October. So we can see people in the mild to moderate range, anxiety, minor depression, and things like that. So we've increased our marketing, our community outreach. It does have a special focus on veterans, so we're doing a lot of work in that area as well. We can see we're actually starting to provide some of our own substance use services under that project for the first time. And it also eliminated the residency requirements too. So again, we used to go through a lot of questions to make sure that you were Macomb County's responsibility. Where did you last live independently and things like that. That's freed us up as well. And it has given us a new funding stream, which Ken will talk about specifically. So that's been kind of the major change for us. The state reorganized itself in March 21st and formed a children's department. There's a lot of focus on children's mental health. I'm sure you've seen that in the papers and things like that as well. So we're trying to rev up as well. Our biggest issue right now is the staffing crisis. It's across the board. We are experiencing it. Our providers are having really difficulty filling these positions. Our revenue is great, as you'll hear, but we actually don't have enough staff to implement the services. So the needs in the community are increasing. Our revenue has increased. Our ability to see more people has increased. But we're missing that third leg of the stool, which is, of course, having the right people in place to provide all those needed services. Some other things, they expanded the outreach efforts. The marketing, you probably have seen and heard some of our information, hopefully. We have been supporting our providers through this time as much as we can financially. So we've looked at our rates that we're paying. Our board has approved a number of rate increases to help our providers out. The state actually approved a provider stability process that allowed us to give providers additional funds to help support them through that pandemic phase. And we're currently still under the public health emergency, so we still continue to do a lot of telehealth services. But we're coming back now in the office more, and a number of our providers are doing the same thing. Those are some of the high points, and then we can go into the budget details.
Sure. Good afternoon, Commissioners. Excuse me. As Dave mentioned, our revenue continues to be very strong and high. We have our projections from the state actuaries. Our revenue is largely based on our Medicaid eligibles in the state, or in the county, I should say. So this year, the actuaries actually projected us as a net revenue decrease of about 0.9%. A lot of what they're doing is based on some uncertainty with the public health emergency. So our eligibles continue to maintain to be high because no one is coming off the Medicaid rolls as a result of the public health emergency. So if you're Medicaid eligible at the beginning of the pandemic, that kind of continues. When the public health emergency ends, we expect that Medicaid eligibility will start being checked again, people will spend down, that kind of thing. Right now, we don't know when the public health emergency is going to end, expecting another extension at least until January 15th. As a result of that, we felt that actually budgeting roughly a 5% decrease in revenue made sense based on that end of public health emergency. That continues to be a very high number for revenue, so we don't anticipate running a deficit or anything as a result of that. But we felt that a conservative estimate would expect that the public health emergency would end in our next fiscal year, and as a result, a slight decrease in revenue made sense. We did budget, as Dave mentioned, the CCBHC's coming on board. Providers that participate in that received a rate increase with some of the administrative differences that program causes. But ultimately, excited about that as a whole. Some of the other highlights, we expect the county's portion that contribute to the CMH to remain flat through fiscal 25. So we have that budgeted at $3.7 million and no change there. We also have payroll costs. We budgeted at the high end of the range and for vacant positions with the intention to fill those, and non-payroll costs assumed to be a 1.5% increase per year. During the year, we also are reevaluating our costing structure based on what the state has required. So under standard cost allocation, which is something the state has put into place for us, we essentially have the same amount of expenses, but the, I guess, categories, we could call them, that they're put into may be different. It calculates mostly how we calculate our internal direct run services and rates. So there may be some changes in the budgeted numbers because of that. I'll go into some details on the actual funds here. One of the things you might notice on the mental health fund is with other revenue. This is one of those standard cost allocation items where we're not required. We lease some of the homes that we provide services in. Providers effectively pay us for that lease. So that revenue is reflected there as part of that change. So that's why it goes from 0 to roughly $2 million this year. Supplies and services had a slight decrease. That was again a reallocation. We had a couple of payments that we make to some of our hospitals that are state mandated, and also our IPA tax that moved from a supplies and services line essentially down to contracted services as part of that adjustment. And again, our internal services are calculated slightly different as a result of that change as well. You can see down at the bottom of page 3 in the handout, again, the county's transfer in from the general fund is flat. SUD, supplies and services, again, that's a reclass item for the HRA and the IPA, which is part of the SUD fund as well. So happy to answer any questions about the budget detail. If I don't have them, certainly research them if it's in the detail somewhere.
We have some questions. Commissioner Hall, please.
Thank you, Madam Chair. Thank you for the presentation. Could you go back and explain that other revenue again, where it went from 0 to 2.1?
Sure. So in the prior year, we would have had, so when we have our providers essentially pay us back for the lease that we're providing, that was net against the leased expense in the prior year. The state reporting changes essentially made us gross those numbers up, so split them out. So we'll have this other revenue line, and then we have a group home expense line that's in with contracted services that it was net last year, but separate this year. Is that?
Nope.
No? I'm trying to think of how I can. So we will have a lease expense, so we pay a landlord every month if for example, it's $2,000. The provider that's actually providing the service in the home, as a result, doesn't have that cost as part of what they're doing for business. So we withhold that cost from their payments, and effectively it shows up as revenue for us.
That's better.
Okay.
Second question, you have a line item called investment income.
Right.
What is that?
That's just our investments with the treasurer and the income related to that.
Okay, that goes through the treasurer's
Right.
office. Great. That's all I have, Madam Chair. Thank you very much.
Thank you. Commissioner Matusek?
Thank you, Madam Chair. You have a line item for vehicle operations, which has gone through the roof here. Wondering about that?
Yep, we have some new vehicles and the related depreciation that'll be charged out as a result of that. I think we have a mobile unit and some other vehicles that came on board, so there'd be an increased cost for that.
When I started back in December of 18, our fleet was in really bad shape, and when I was asking questions, it was fleet. So we made an effort to try to replace that, and then when our revenue started to improve, we were able to work through the county and actually do some fleet upgrades. I was told we had the worst fleet in the entire county. So we do have mobile services. We have assertive community treatment services. We have our clubhouse that has some larger passenger vans. So we were able to replace those. There was a number of supply chain issues as well, as I think lots of people are familiar with. So that those were delayed. But we've made really good progress on having operational vehicles at this point.
That's good. I have a couple of service questions. I noticed on your supplemental, it said you were working on same-day access.
Yes.
What does that mean?
So access to services has been a key issue for us for a number of years. We have a single public-facing phone number now, the 1-855-99-MCCMH. Those calls are being answered very promptly. But when people are trying to access services, like I said, our providers are experiencing staff shortages, so we've been working with them about our centralized calendar and making it easier for people to access. But there is a national consultant who has a really superb track record of streamlining that whole front door process. So they've worked with Easter Seals locally, and we were able to contract with them. We started, I think, Monday of this week with that streamlined process. So we have walk-in hours now at our North Clinic, and they're on Groesbeck, just south of Hall and Elizabeth. And people can just walk in. The way it works now is we have some of our office staff and some peers will help people do the administrative paperwork, collect some of that information, focuses then our clinical staff in. They can start helping right away and connect the person with a psychiatrist if needed. And what happens is the person stays in one spot, and then we rotate people in to see them. So we're up and running with that. We will be expanding it to our other clinic sites in St. Clair Shores, and then in our West Side office as well.
That's a great improvement.
Yeah, we're really focused on access. We have some more work to do there for sure, but we're making really good strides.
All right. I would suggest at some point a report to the board about like actual numbers.
Will do.
What it was before we started implementing, what it is now that you've started to implement.
Very happy to do that, yes.
Because I think it's important that we be good at this same-day access. When people are in a crisis, they need services.
When I go to the statewide meetings, access to services they're always in their top two, and it's really important, obviously. Like I said, with the children's mental health needs increasing, the substance use increasing, so we are putting a lot of resources into our front door.
That's good to hear. The second is a related question. Now that we have a national helpline number, are we prepared to deal with calls influx from this national hotline number?
Yeah, so I get a daily email report about the calls into our customer service line. August was our highest month ever. The problem I'm having right now is on the data side, is I can't break out the 988 calls yet, but I'm getting close to being able to do that. And when I have that, I'll be able to start tracking those separate from the rest of our calls and show the increase in those calls and how fast they're handled.
And do we have the capacity to?
Yeah, we've been
this?
actually Macomb has been part of the National Lifeline Call Center for a number of years before I started. So parts of the state are using different vendors to do that, but Macomb is doing it ourselves right now.
Okay. Thank you, Madam Chair.
Thank you. Commissioner Kleinfeld, please.
Thank you, Chair. Just very quickly, in 20 and 21, what were those transfers out?
Transfers out.
If you look at the other financing sources, I mean, we're used to the transfers in. I'm just wondering, what were the transfers out there?
What page?
E4. They're in parentheses.
We don't have your handout. We have a different book.
Oh,
Yeah.
Oh,
Okay.
do we have something different?
It's titled Enterprise Fund Detail by Category Community Mental Health.
Hi, Steve.
Well,
Okay.
if
This is what
we were
we're
all
looking
seeing
at.
the same thing, that would be
suspect it's risk
helpful.
reserve.
Oh, yep.
Yeah.
That's, so yeah, we're able to, we have a risk reserve that we can fund to cover any future losses. If in fact revenue does come down and we're running a deficit, it's something that kind of a safety net, if you will. So that transfer out is a transfer out within our own funds to fund the ISF.
Okay. Okay, so this is just curiosity. I know that community mental health has had a roller coaster over the years, and it looks like we're getting into a good place. The amount from the general fund stays fairly flat. If you go prior to 2020, have we always put that money in from the general fund, and has it always been about the same amount? And is there a reason for it? A specific reason for it?
Right. So when I came aboard, at least, the number hadn't increased a lot. We feel that the position we're in, keeping it flat, makes sense. The state does require that we have a local match for some of the expenses that we have, so that goes to fund that. But we don't.
Now that makes sense. That's okay. What my question was. Is there a requirement for some sort of matching or something? Because when you look at a budget, the size of the budget, and then you look at what we're putting in, it just seems insignificant. And I was just wondering why that had developed. But that explains it right there. Thank you. Thank you, Chair.
Thank you. Commissioner Kraft?
Thank you, Madam Chair. I don't have any questions for you guys. I hear from you all the time. But I just want to mention for the board, 5 years ago, I was put on the CMH board, and it was like walking into the lion's den. It was a lot different than it is now. We've done a 180 turn in terms of finances, services offered, things like that. For the concern of this board, I mean, back then we were begging the state for just grant money to help us not come to this board and get general fund dollars. I mean, I think we got $5 million from the state just to help keep us afloat. And now reserves full, the savings is full, and for us that puts us in a good spot because we as the Board of Commissioners don't really have to worry about CMH currently. I mean, it is a roller coaster of funds. We have funds from the state, from the feds, from the county. I mean, they're from all over the place, and right now with what's happening or could happen in Lansing could affect us severely, or everything could stay status quo until next year. But I just want to thank Dave and the whole team, all of our staff, for everything that's happened the last year or so. We've really worked together to put together a tight ship, and I think we're moving in the right direction. I'm proud to be a part of it, and Commissioner Wallace too. Like I said, we hear this stuff from you guys all the time. I try to toot our horn at board meetings and to board members as much as I can because I think we are on the right path to helping as many people as we possibly can. So thank you. Thank you, Madam Chair.
Thank you. Through the chair, I forgot one comment. I also wanted to highlight the staffing crisis is our number one concern. Second is the emergency room use and jail diversion. Our healthcare partners are doing an exceptional job, but they're struggling, and I've met with all of their leadership as well. There's way too many of our folks in their emergency room who should be someplace else. They should be in a state hospital. They should be in an inpatient psych hospital. They should be at an appropriate community option, someplace less restrictive. The staff shortages is definitely impacting that. So we are doing a lot of work right now on our crisis continuum. A lot of our mobile crisis screening stopped during the pandemic. We're getting that back up and running. We're bringing another one of our crisis residential homes back online that was closed because of the staff crisis. But we're also looking now at a crisis stabilization unit for Macomb County where people could go in a mental health crisis instead of going to the jail or to the emergency room. We are looking at a jail diversion. We did an RFP and we're looking at moving forward with that. We're working with a consultant right now on the engagement center, which would be a 24/7 facility for people with substance use issues to go to. Heavily peer-driven. It's kind of the living room model. It's a very warm, welcoming, comfortable setting where people can go, sleep it off a little bit, take advantage of whatever help they're willing to accept at that point. We'll have information and help available to them. So we're looking at that, expanding our available crisis services as well. So hopefully next time I come in front of you, I'll be able to share some good news along those lines as well. Thank you.
Thank you for the explanation. Commissioner Hall?
Thank you, Madam Chair. I'm playing Geppetto, so these questions are on behalf of the chairman, who can't speak. Are you thinking about building out the Juvenile Justice Center for mental health treatment tied to the jail? At this, you were kind of touching on it a little bit.
Yeah, I have the blueprints in my office now, and the JJC presents just a ton of really interesting opportunities for us. I've made a connection with the folks at the state of Michigan. There is money in the state budget for crisis stabilization units. The money's there and that's it. So now the folks at the department are scrambling to try to put some detail to it. But I've made that connection and I'm part of those conversations now. The jail diversion program could be used out of the JJC. Our central crisis stabilization unit could be used out of the JJC. The engagement center is a possibility there. Also on the children's side, if you divided, you could split the building. As long as they're separated by sight and sound, that would be a possibility. The state's looking at a new service called a Psychiatric Residential Treatment Facility, or PRTF, which would be a locked, secure setting for children in mental health crisis. That would be shorter term than a state hospital. The state of Michigan took 110 state hospital beds offline because they're having staff shortages. And then they're looking at the people who are in the state hospitals and then telling us we need to get them out promptly, and we're struggling to meet the needs of people at that level in the community. They've also now said that anybody with a developmental disability will not be going to a state hospital. So that puts us in a really big crunch too. People with developmental disabilities do present a mental health crisis. They might be eligible for a state hospital, but they should be going to what's called an intermediate care facility for people with intellectual and developmental disabilities, and that does not exist in the state of Michigan because they closed the last one, which was the Mount Pleasant Center. So now you can see we're, you know, rocking a hard place. People with developmental disabilities who are presenting with a lot of really challenging behaviors, we don't have any place for them to go. And then if they do present in an emergency room, then we have that pickle that we're dealing with too. And the impact on these individuals, the families, the caregivers is significant. So we're working as diligently as we can, but it's a really, really tough situation right now.
It sounds like one of those infamous unfunded mandates. We're not going to do it, so therefore you figure it out.
That's they did that in an open meeting at the state level. They basically said, this is the way it is. We're going to present this, you know, at a leadership level at the state next. But as of that day, that's how quickly we found out. So we've been struggling. The crisis expansion will help, and we'll make sure that people are diverted and kept in the community as much as possible. But yeah, this is a really big priority for us and a real need for statewide.
Well, touching a little bit on Commissioner Kleinfeld's comment about the fund balance, it's at 16,319,704, and it's straight lined across the board. It sounds to me like you've got a lot of opportunity. Do you have plans for utilizing those monies? Again, the money's not a problem right now, which is, it's just weird to say that. We also are working with the county executive's office with the opioid settlement dollars coming in. And like I said, there's money earmarked for crisis. So there's a lot of funding opportunities available for us. We just need to get those services up and running. So I will be issuing an RFP for a crisis stabilization unit. The jail diversion one has already been issued and finalized. And the engagement center one is underway as well. Well, I just want to repeat the comments of our chairman, Phil Kraft. You guys are doing a phenomenal job in a unique situation when you start getting unfunded mandates thrown at you, which, if I recall correctly, when I was a state rep, they said we were never going to do that at the local level. So
yeah,
I do remember those comments from back then. But to our chairman over here, thank you for all that you do as well, and Commissioner Wallace. That's all I have, Chairman.
Thank you. Commissioner Song, please.
Thank you, Chair. I had a question about the utilities that went down significantly, and then the repair and maintenance went up 50%.
Sure. So the utilities, unfortunately, there's two pieces of that. So we had the administration building. There was some overlap between when we opened the new one and when we closed the old one. So we kind of had two buildings going at the same time until that lease exited. So there's some increase in costs there. There's also basically an account coding issue that caused last year's to be overstated by roughly $200,000. So that would be.
I'm sorry, could you clarify that again?
There's a account classification issue in last year's budget that caused utilities to be higher by $200,000 or so.
Okay.
And then the other one was
repairs and maintenance.
Yeah, so that, I think that kind of goes into how we're looking to budget and some of the buildings that we have and what's going to need to be done. Some are newer, some are older. So we felt that allocating some additional funds there made sense.
Okay, so does the repair and maintenance also include the vehicles?
Yes. So that would be part of it as well.
Okay. Steve, do we have an actual year-to-date for the utilities for 2022? The actual?
I can get it.
Yeah, we'll have to get that from Ken because they leased most of their facilities, so they're not on our books.
Got it.
They lease space from us at Majestic and Southeast Health. I can get numbers for those buildings, but specific to where their facilities are, that's all on their books.
Okay. All right, if you could get that to us, that'd be helpful.
Sure, and I will say that utilities in general was one of those that's easier to predict when you pull the actuals through date and just roll it forward for a full year. So I expect that to be much closer this year, but I will get that for you.
Okay, thank you. Thank you, Chair.
Thank you. Commissioner Wallace, please.
Thank you, Chair. Not so much for you guys. You do great, so that's good job. But for the commissioners, I just wanted to say, if you know of any event or anything that's going on in your district, please reach out to the community of mental health to see if they can be involved in any way, whether a mobile unit or a table, depending on what the event is. The more that our community knows that we are here to help them, the better off we will be. I know they will be involved this weekend at the festival and, wherever else in your districts that you feel that they can be helpful. So please feel free to reach out. I did mention at one of my community events that, we were having like radio commercials and everything. So someone called me and said that they heard the commercial and they were pretty excited. They were more excited than I was. So please keep it going. Like I said, you guys are doing great and I'm just happy to be a part of it. Thank you, Chair.
I don't see any other speakers, but I have a couple questions for you. Of your counseling staff, I would assume they're counselors or however you refer to them. How many more would you like to have, or what percentage of what you have would you like to have?
I'm not sure about percentages. I know across the board we currently have about 40 to 45 vacancies that we're trying to fill. Children's staff is an issue. Our clinical staff on the children's side do a lot of evidence-based practice, which requires a lot of additional training, and it's costly on our side. And then what happens is they get pulled away from other counties and
Yes.
in order to, do better for themselves. And then we have to rinse and repeat and try to fill that position and get them trained up again.
So you need them to be paid better, also.
Yeah, pay is an issue, definitely. I know Region 10 was hiring away a number of our children's clinicians. Yeah, my chief operating officer recently went to Oakland County to be their chief operating officer, and is making more than me now. So
Don't leave. What would be your advice for handling children or dealing with children with maybe they're not quite happy, or with the school situations for a mom and dad? If you could give a couple sentences of what to do. Maybe not 2 sentences is enough.
A couple sentences.
Yeah, I don't know. What would you say?
It's to seek help early, for sure. The schools have a lot of resources, and in the recent state budget too, they've received a lot of money for mental health. Our concern there, of course, is that the schools have pulled away some of our staff as well, because they have the additional funds and they can pay them more. But that help is available, and at the first sign, they should be asking for help. Early in the pandemic, the CDC did a study in June of 20. The pandemic started in March. They found a little bit, it was like 25.2 or 4% of the children surveyed had actively considered suicide in the past 30 days. That just stopped me in my tracks, and I checked the source, and it was accurate. And those numbers continue to play out until the most recent stuff that I've read. That's a frightening statistic. So our children are really need help, and it can happen to anybody. The signs going into it sometimes can be missed, so they should be seeking help. And we're trying to build up those supports as much as we can. We have a really good working relationship with the intermediate school district. They have a lot of great resources available. But as Commissioner Wallace was saying too, it's getting the word out that the state has resources, there's help available, and they shouldn't be a ashamed or concerned about asking for help, seek it out early and then go from there.
Many households have both parents working, and the children have lots of activities. Everybody's moving. Do you think that is helpful, or do you think less activity might be more calming? Do you think
that's kind of individualistic. I mean, there's some children who just thrive with that level of activity. Yeah. If it's overly encouraged by the parent, that can be very stressful for the child. So the child themselves is the best barometer of those types of activities that they want to be involved in. If it's their personal choice and it's it makes them happy to be involved in that, then I think it's a great thing and we should encourage that.
Well, some parents will say versus the phone all the time or whatever.
Yeah.
Do you, I don't know if you can answer this question. In the county, do you think that the schools are, how do you think the schools are doing in regard to parents and children feeling secure?
Point of order, Chair. It's a budget meeting and we've been off budget for quite some time. I just want to point that out. Thank you.
Thank you.
I'd be happy to follow up with you later.
Okay. Well,
I think that the schools are handling a very difficult situation really well. When I meet with them, I'm like, when I'm having a bad day, I'm kind of glad I'm not working in the school system. They have a lot on their plate and they're dealing with it really well. But again, their focus is on the student. We can focus on the family unit and the child.
Thank you. We will vote now.
Motion passes 12-0.
Thank you.
Thank you very much, gentlemen. We will now go to Martha T. Berry, the budget.
Chair, I'll make a motion to receive file 16.
Thank you. The motion was made by Commissioner Farrington, and the support was from Commissioner Sabatini.
I do think it's important to have a quick conversation about why Martha T. Berry is Martha T. Berry. I was shocked to find out that we had somebody in the county that still didn't think that we were actually part of the county. It was a department head when I was talking about it. So, we are different for a number of reasons. But survey, this is a kind of combination of last month's presentation this month as to why we're here. So average number of citations in the state last year and this year is between 9 and 11, depending on the size of your facility. But this year we've had 4 citations. I also want you to know that if you take a look at why we are different, we're different for a couple of reasons. The number one reason is we are the social safety net for Macomb County. There's only 32 county facilities of the 88 counties and 442 facilities in the state. Our number one referral source is other facilities. As a matter of fact, yesterday and today we had 5 new admissions. 4 of them were from nursing homes and 1 was from home. None were from hospital. So I hope that you understand that we are not just another nursing home, but we are the one that the nursing homes go to when they cannot care for someone in the community. The families are grateful for Martha T. Berry. If you take a look at one of the videos, and you'll appreciate this if you have some medical background, this dear daughter said, you can tell how well she's cared for in our facility by how many medications she's not on. That was, you'll see that in one of the videos we have on our foundation. Another brother, actually this was a county staff member, asked for our help with his brother who was just failing at another nursing home, and they would not discharge him because they said they could not get their discharge evaluation done. So we sent our social worker and our clinical team over, did the evaluation for them, and his brother said that we saved his life. So we are different in a lot of ways. Interestingly enough, we talk about staffing. We're in the top 3% in the state and nation in terms of staffing levels, and our turnover rate is 10% better than the state and nation. That's good for a number of reasons, partly because we do things differently. But in recent hires, I always greet the new hires that come in. One said that they wanted to come here because they, in their last place, they had to buy the washcloths from Kmart to be able to care for their loved ones. Another facility said, I'm at a for-profit facility, and we were buying snacks because they didn't have enough snacks for our residents. So we're that safety net, and that's why you can see that we continue to be, as you see by these numbers, a significant part and a resource in the community of long-term care facilities. We're just not another one of those. So if you think that we can just go away and that they'll be cared for, that is not accurate. We're needed here. Okay. So we talked a little bit about the estimated annual liability in perpetuity that we have. Total estimated annual legacy expense about 1.2 now. This is the last year that we had the building use agreement, and we are slow paying that. We are paying it, but we're slow paying it because of cash flow issues this year, which we predicted back in 2018 when we first started having the conversations. We're doing well with that. You can see it in our budget when we talk about that. But this legacy expense, the OPEB bond repayment, actually nets us a loss in our operating expense for the next 14 years of roughly $600,000 every year. It's because when it was bonded, we were only allowed to get reimbursed for 3 years from it, and then the rest of the time, you could only expense the interest, and that goes against our plant cost. We can't use it in operations. So that it hurt us for the next 14 years in that way. All right, I was asked by the commission to, when we put our budget together, you see our budget for next year, it's slightly less in total expenses than the current year. You'll see that in a number of ways. We have to manage our expenses based on what our anticipated revenue comes in, and because we had to reduce our census due to COVID issues, we have to pare back. So that's what we're doing. We're making sure that we're living within our means. That, in spite of the fact that we've got 12% inflation rates in so many areas, and the competitive nature of hiring, you see Target's hiring for $16 to start, and our housekeepers don't make that right now. So, but the commission asked me to put 4 capital needs, my 4 most important ones, in the budget, the capital budget, which I sent to the executive office. And from what I understand, the county exec did recommend the HVAC upgrade. However, he's recommending $1 million, which essentially is funding the HV in the HVAC. So I'd like to talk to you a little bit about that. Also, I'd like you to know the reason that I'm having the conversation in the first place is there was $172 million that came in specifically to the county, and I was hoping to get some of that. I did not expect it to come from general fund. I was hoping to be able to get some of that because that money, part of it was earmarked for long-term care. But I do understand this is a huge county with a lot going on. So any help you can be, I'd be most grateful. There are some challenges to the numbers. I'm sure you've heard this before from other departments. We just don't have any ability to do a successful RFP right now because of the length of time. Supply chain, what we do is even simple quotes. They say, are you ready to buy? I can get it for you today if you get it for this. So I've been working with our board on some emergency purchasing and some sole sourcing. So just be aware that because of the supply chain uncertainty and labor shortages, actually in that, I'm sure you've heard it as well, we may have some challenges in that way. Those were the most accurate numbers I could get in the short term. Okay. So what we've talked about is those 4 items. Any help you can be, I'd be most grateful. Remembering that this is your facility. This is the county-owned building. Every single piece of equipment in there, the building itself, all belongs to Macomb County. I am the steward for you in that area, and I'm asking for your help in any way that you can be to maintain your building while we take care of those most vulnerable in our community. And that's all I have, Madam Chair.
I see no speakers for that. So I think, is there? Oh, all right. Okay, that was under the other area. Commissioner Matuszek, please.
Thank you, Madam Chair. HVAC and then
PTEX, yes.
What is that?
That's the individualized personal machines that are in each wall for the residence rooms. So much like when you go to a hotel.
Got it.
That wall mount one is PTEC. It ties in with the HVAC unit. That gives individualized temperature control in the room, while the other one does airflow and helps moderate the temperatures.
Got it. I wasn't sure what that was. I think you all do extraordinary work, and you are the epitome of what county services should be, taking care of the people that have no one else to take care of them. I am glad that the county exec put in some money, a partial payment for HVAC. I would really like to encourage my colleagues to figure out how we come up with some more to, in my mind, we either set you free, really free, or we acknowledge that you are our responsibility. And this weird setup that we have doesn't, I think, serve anybody very well, either the county or Martha T. Berry. So thank you, Madam Chair.
Thank you, Commissioner. Commissioner Kleinfeld.
Steve, I have a question for you regarding the past. So back before the change that took place when I was brand new, and there's all this stuff going on, right? And I was like, I don't know what's going on, you know. Who negotiated the pay and benefits of those employees?
County HR, because they were they were just part of the personnel roster of the county before the JOA. I'll say that.
Okay, so the county negotiated the debt that they carry, correct?
You talking about the OPEB debt?
Yeah.
Yeah, they're part of the pension system, part of the retiree health care system. We structured that plan for the entire county.
You mean the money that we put in, the 300-some million that we put in?
Correct. So the actuaries calculated the unfunded liability for the retiree health care plan at the time, separated it out by group, so we knew what the percentage of the unfunded liability pertained to Martha T. Berry, as well as the sheriff in general, and the sheriff in General Rhodes has got their own.
So if they cease to exist, whose responsibility are those benefits?
If they cease to exist, I would tell you it's probably a county responsibility. We'd have to get legal involved, but I would, in my mind, it would be a legal or a county liability.
So we get bogged down on these smaller dollar amounts that could keep them afloat, when in fact, if they can't stay afloat and they cease to exist, we take on a huge debt. That would be your opinion?
That's my opinion without legal getting involved. So I can't commit to that answer, but that's what I believe would happen.
Okay. And so we got, how much was the ARP?
169, close to
169,
170.
And we have these two big projects that we want to do. We never had a meeting with the board where we had any discussion about anybody else's input, which is fine. The county exec wanted to create his plans for all that money and show that to the board. And I think they're good plans, and I think they're things that we should be doing. But we're not talking about a huge amount of money here in the grand scheme of things. So if they cease to exist, who's got to replace the HVACs? Who's got to update that building? Who's responsible for taking care of that building?
if they cease to exist and we cease using the building for the purpose that it is,
Yes.
as long as we utilize or don't utilize the building, we don't have to do anything. If we repurpose it for something, I would tell you the county.
And even if we don't repurpose it, it's our responsibility to keep that building up, correct?
I would say yes. Again, without
So
dissecting
it's
the
sort of
JOA
like
and
a
everything.
rental situation, right?
Pardon?
It's sort of like a rental situation?
In the sense that, yes, but the JOA requires, we're getting way off target, but JOA, as I understand it, requires North Seabury to maintain the building, even though it's a county building. We charge.
Right. Which
It's
is
just the way it's written.
right. And I know that there was a different board leadership at that time. I was brand spanking new when this thing was developing, and I am now the second longest serving commissioner. The director, Martha T. Berry, was not there at the time, and the county exec was fairly new at the time. I think he had a couple of years in.
I believe the JOA was in effect before the executive form of government came into effect.
When
2009, 2010. It was before the shift in the form
there was
of
a
government.
renegotiation then when I came on, because I remember a big fight over it, and I don't remember exactly what happened because I was so new. But I remember there was some sort of fight over the agreement. I don't know what we were changing, but anyway, I think my point is. I want to do all the things the county exec does, and I don't know what's going on with the infrastructure at the federal level, and if we're going to have an influx of dollars with respect to that. But I do know that it costs the county more money if they are not successful and that they can't stay afloat, and it costs the residents severely, and I just. This is a situation where I think we could all come together instead of being hung up on that agreement, recognize, and I know Don's concern is we're going to go back to 10 million a year, and I don't think that's the situation that we're facing, but recognize there's a benefit to this, and we could work it out. So anyway, that's all. Thank you. Thank you, Chair.
Commissioner Hall?
Thank you, Madam Chair. Don't leave, Schmeek. I really don't know how to follow on that conversation, but I do recall last year's budget, we had discussions about revising or eliminating the JOA. We had discussions about you becoming an independent entity, and the discussions could still be going on because of the legal people that all got involved in all this. And I thought the rationale was we're not going to let him go independent. We're going to take care of the facility as best we can, whatever. Am I right on that, Kevin?
Yeah, changing us to an independent puts us in the same for-profit, not-for-profit realm, and we could not do the same things that we're doing now. So we would also lose roughly about $3 million annually in revenue into the county because we would change from a Class 3 facility to a Class 1 facility.
So the cut bait and run philosophy, or separate you from the county, at that time was stated not to be economically feasible.
In my opinion, it continues to be not economically feasible, and also
Okay,
from
so
a systems standpoint
check mark.
too. Right? Yes.
We got one thing accomplished here. Secondly, on the ownership of the building, I just heard you say we, the county, own the building.
That's correct.
I want his head to go north and south too.
It's a county facility.
Okay. He came up with HVAC, and I don't even remember what the other three things were. It's really irrelevant, but the amount was $4.1 million. of which he was told he could replace a roof, or was that right? The HVAC?
Half of the HVAC system.
I'm trying to clarify this, not make it more confusing,
Right.
but it's not working so well.
So you know, we had 4 items then, just so you know, we had a 13-item plan that we presented last year and again this year, but this is over a number of years. We're looking at replacing these as money allows. You know, as soon as the building use, we pay that off, you know, my expectation is to start using part of that money to put into a sinking fund while we use the rest of it to start shoring up some of the things that we're missing.
Okay, but your comment was, of the 4 items, 1 got approved. Was that the HVAC?
One got half approved, yeah.
Half approved?
Right, yes.
Okay.
The HV of the HVAC got approved.
So collectively, the 4 of them, let's round numbers, was $4 million.
Yeah, 4.4, yeah.
Okay. So now I'm going to go to Mr. Schmiegel. He made a presentation saying I need $4 million for these 4 things. Somebody approved half of an HVAC or half of a roof or something. What's the logic in not approving all of them?
There's multiple reasons for the logic. One, if you look at the capital plan, there are a lot of things on the capital plan that are going to require a lot of general fund money in the future. 2, we have this JOA so we're providing some relief to Martha T-Berry that by JOA, or the Joint Operating Agreement, I don't think we necessarily need to do, but we're making a good faith effort to at least help them out in some way and still be able to fit all the other capital items into the capital plan with the funding availability that we have.
Okay, I noticed he's not complaining about getting half of something here, and I think that's because he doesn't want to upset getting the half of something versus getting nothing.
You are not wrong.
You don't need to acknowledge that, Kevin, but okay. So the capital outlay plan has numerous projects in there. I understand with the JOA we're being very cautious of what we're investing into the facility because the ownership issue. If we determine that's a higher priority than some of the other capital outlay recommendations and want to do that this year, I don't know how you do half of a roof or half of an HVAC or whatever it was. That's going to be a bone of contention coming back your way from our recommendation, and I think we need an agenda item that says, once again, Martha T-Berry, who owns what can we do, because I'm not going to approve a budget where the guy gets a half of an HVAC and he's telling us he needs a roof.
Point of order, Chair. Commissioner Hall, just to be clear here, based on the 4 items that were requested, 1, that HVAC rooftop upgrade is completely funded in the capital improvement fund.
So that's 1.
The 3 others are not.
Okay. So there's 3.
But let me clarify. So it's on the plan for the full cost of $1.8 million, and you look over to the right-hand side again of the plan, there's $1 million from the general fund, and there's $808,000 from other sources, which is Martha T-Berry in that particular instance.
That's right.
Correct.
So, Joe, would you say that again, please? I'm trying to clarify this.
It's funded
and I
on
don't think
the
I'm doing
plan,
a good job.
It also identifies funding sources.
That would be correct. So Steve is basically saying that the $808,300 is coming from another source, which his source would be Martha T-Berry.
Correct.
Okay.
So what you were saying, Commissioner,
I honestly didn't even
correct.
look all the way to the right of the page. I just saw the big number. So
You're excused, Joe. It's quite all right. You have a lot of numbers in front of you. So, we can amend the capital outlay recommendation and say we are willing to spend $4 million to get these things done and pull something out of capital outlay to pay for that. Is that correct?
I would say no.
No.
Because it's, the board does not say what's on the capital plan or prioritize. What you could do is add to the general fund line item transfers out, if you will, to the capital projects fund. That's the way, that's mechanically what would have to happen.
Okay, I think that's the comment.
So we got
Don just made here.
roughly $9 million of general fund contribution identified for projects on the plan for 2020, or I'm sorry, 2023. If it's the board's intention to provide more dollars to Martha T. Berry, I would submit to you that I wouldn't expect the executive's office to reduce other projects on the plan because we think they're all necessary and needed. So what would have to happen is the contribution would have to go to another $3 million, so $12 million. That's the way I would say mechanically it would have to happen.
Okay, I understand the necessary and needed part, but he's saying he needs a roof. I mean, necessary and needed, that would fall in that category as well. I know you're trying to explain the logic of him asking for $4 million and $1 million being approved, plus on the far right-hand corner, the 800,000. So that's 1.8 million at a request of 4.1. Is that right? Am I saying that right?
Say that, I believe, repeat, please.
Okay. His request was 4.1. He is
4.4, but regardless, 4.4, but I know where you're going.
I'm getting frustrated going there. His request is 4.4. The recommendation to him is 1 million plus the 800,000, so that's 1.8. And that's what's coming back from your office, correct?
1
million.
So he's got 4.4.
And the 800,000 is coming from other sources.
Martha T. Berry.
Okay.
So think of 1 out of 4.4 coming from the general fund.
Okay, so 1 minus 4.4 leaves 3.4 short.
Correct.
Somewhere, right? At his request, right?
He would, yes, Kevin would like another 3.4 million from the county.
Okay. What I think we need is, once again, an education on this JOA, when it was signed, who was here, what did it mean, did the circumstances change, how does the funding mechanism deal with this? And I thought we had commissioned a study or something, or a document that said, this is Martha T. Berry, everything you want to know. Now, I've read that twice. Each time it was more confusing than the first time. So I still don't know today. He's indicating he's made a request to the executive office. These things are critical. I mean, those sure as hell aren't wants and, fluff when you're talking a roof. And you're saying he gets $1 million, figure out the other 3, in effect, or you're not going to get it done. This is where we need to understand what he's making a plea, only he's not, to say, I need this funding, these are critical items. What role can we as a board, hopefully in cooperation with you guys, play to make this work? Because the discussion of severing Martha T. Berry, making them independent, that all went out the window last year when we had the lawyers come in and explain it. So what is our we just had the sheriff come in and say, I need a new intake center, and I don't recall us telling him, you're only going to get half of what you asked for. So I'm looking at it in the context of who owns what here. I know he's claiming he owns the debt, but doesn't want to own the debt. And now he's saying I need repairs to my building, and we're saying you can have half of what you want. No, half of one of the things that you want. So I don't know if somebody's got a brilliant explanation here, but I can tell you it's certainly not me. But when a guy tells me he needs a roof and an HVAC replacement, I understand there's funding mechanisms and agreements and all those things there. I have a tendency to say when we're sitting on a $100 million surplus, maybe we ought to get him a roof. I'm done, Madam Chair. I don't know what else to say or ask here. No, Kevin, you're not going to help. I can tell you that.
Thank you. Thank you. Commissioner Wallace, please.
Thank you, Chair. So, Kevin, first of all, I think you're doing a great job. I have had the chance to come visit, and everything that I've seen was remarkable. I do have a question about your budget and personnel. I noticed that the budgeted cost is going down. How are you able to lower the personnel cost when most are going up?
Well, it's not by much. You'll also see that we've added into our agency cost because we recognize that that we can't hire all the people that we need to hire. So previous years we didn't have an agency budget, so we increased that in our contracted services, and you'll see that reflected there. Our wages are going up.
Okay.
So that's where that's at. But we've also done some things because we have limited census. For example, if you have one COVID resident, they take up 3 rooms, the room they were in, plus you have to put them in another semi-private room by themselves. So we have, by regulation, a compressed ability to fill our facility right now. But you'll see that it starts to creep up a little bit more after that.
Right.
Again, but we're hoping to be able to flip that script on the agency.
Right. Okay. Yep. I do notice that. So thank you for that explanation. I did want to touch a little bit about your capital needs. I completely agree with Commissioner Matuzek and Commissioner Hall. We need to figure this out. And I understand there's an agreement, the JOA, which, of course I wasn't here and I'm still trying to figure that out. But it seems like those that were here are still trying to figure that out.
Right. And if I may say one thing to that, the joint operating agreement referred to operational costs, right? Mm-hmm. And it had no way of anticipating what was a good faith effort to manage OPEB by the county, but not understanding I don't believe they did that intentionally. When they funded OPEB, I really think that they didn't understand how devastating it would be to us. And nobody knew it. So it took me a couple of years to kind of figure it out, and that's when I started talking to the board. But no place in the JOA does it say that it has to be funded by Martha T. Berry.
Mm-hmm.
It says we're responsible for maintaining the building on behalf of here, but it is silent on the funding source for that.
Okay.
So to use that actually is kind of a red herring in my view, because there's no place in the JOA or in the building use agreement that says it has to be funded by. It says who's responsible for it.
Okay, and I think Commissioner Haw mentioned something like, can we review, can we get an understanding? I mean, we don't know what's going on. It seems like no one knows what's going on. We're just getting, this is what I got from this JOA, this is what my understanding is, and your understanding is one way, your understanding is another way. We need the correct understanding. We need to know exactly what this means and what we can do. Because at the end of the day, Martha T. Berry is taking care of people that they have critical needs. So when their HVAC system goes out because the county did not help them, when their boiler goes out because the county did not help them, do you think the residents or the family of those people are going to say, well, there's a JOA? No, they're not going to care. And when my residents come and ask me, I'm going to send them to the executive's office so he can explain. Because, I mean, when you come and ask and you're turned around because there's a JOA and we don't know what the JOA is or have a clear understanding, but it seems like the executive's office does, or maybe they have an understanding that they think.
I do believe that Steve honestly believes what he just said, in that I'm supposed to be financially responsible for it as well. And that's the spirit of it when it first came out, was that the county was providing out of the general fund every year. And the goal was not to have that continue. The goal was to have us working self-sufficiently. So that when they bifurcated HR departments, there was a lot of concessions that were happening at Martha T. Berry that didn't happen at the county. And when I got there, the CNAs had not had a raise in 10 years, literally not have a raise in 10 years. They were given bonuses one time to suppress the wages, which really hurt recruitment at the time. So I had to fix a lot of that stuff.
Right.
We also, and we've talked a lot about that. So now you can see very clearly where we're at. We're in much better shape. But nobody anticipated at the county, and before I got here, that the OPEB bonding, which they thought was unambiguously a good thing, was negative to us because it stopped us being able to actually do 100% funding on OPEB for 20 years. We could get reimbursed for it for 3, and they didn't know that, and I wasn't here to know what happened there. So, so that's one of those things that changed, Commissioner Haw, that was that we had no way of knowing. We're losing $600,000 a year net because of that decision.
I think that you're being a lot nicer than most would be. I'm just going to say this, and I'll move on. When we see this intake center being built and it's nice and new and shiny, and we have seniors that may not have a working boiler, that's a problem. And I'm sure my district will not sit quiet. I'm not for sure about everyone else's. And I'm sure the family of those that live and depend on Martha T. Berry will not sit quiet either. Thank you.
Thank you, Commissioner. Commissioner Sabatini?
Thank you, Chair. Hey, Kevin. A couple questions. I'll talk about the capital needs in a second, but going back to what Commissioner Wallace was asking in regards to the personnel, I don't understand how your personnel line item can go down and your employee count can go up.
It's relatively the same, but what we've got is less overtime going on. We have agency going on as well. So we're reducing the number of hours,
okay,
but not laying people off, because that's another issue too. We don't want more people on assistance. So throughout the pandemic, we did not lay people off, which was a big challenge. The other thing that we anticipated next year is that we would lose the $2.35, which I just remembered now, that was a reimbursement structure coming from the state of Michigan that was in there. So we had anticipated that being that ending this month, and we got notice yesterday that is going to continue on. So,
okay.
so that $2.35 per hour per resident per staff member direct care will be added back into that budget when I finalize it with my board. I'd be happy to share that with you.
That's the addition?
Yes.
Okay. Okay, in regards to the capital needs, who would be responsible for, let's just say, contracting that HVAC rooftop upgrade? Is that something that you would be handling, or F&O would be handling?
It's in cooperation with them. We're responsible, according to the building use agreement, to maintain everything except all the way to the curb, and then the F&O maintains the parking lot and the lights inside the parking lot and the striping. That's part of the building use agreement. So we're responsible for putting the bids out. What we try and do is when we know that F&O is going to be doing some things at the morgue or over at the jail, we say, hey, can we piggyback some of those to kind of maximize efficiency and cost? So when lighting's going up and things like that, we work with them on some of that. But we're responsible for it. So we have to do the bidding. We have to, on large cap projects, we get our board approval first to be able to do that. Then I move it through over to F&O, and then we work with Mark Delden and get approval, that we can do what we need to do there. Then it comes to this commission, just so you're aware of what's happening with your building.
In the past, when that happened, I can't remember, did we pay Martha T. Berry directly, or did we put the money in the capital improvement fund?
I wasn't here when you ever gave us money, so I'm sorry that I don't know that.
Steve, do you know that answer? When we do a capital project, when they do a capital project.
Are you asking prior to the JOA? We haven't provided any dollars to Martha T. Berry for quite a long time. If you go back in history, there was a special revenue fund that would have capital in it. This was long before we did a formal capital
so I guess
plan.
My question then is, and that's what I was trying to remember if we ever did it that way. So my question then is that why would we need to put the money in the capital improvement fund instead of just simply put it in Martha T. Berry's budget if they're handling it all?
We put it in there as a identifier for the board to identify for the board that we were trying to provide some assistance to Martha T. Berry.
But we could simply put it in the repair and maintenance line item if we wanted to. And remove from capital
facilities?
And remove that transfer.
In facilities?
In Martha T. Berry's budget itself. Or capital outlay. Thank you, Commissioner.
And then we'd have to have a revenue of some sort in Martha T. Berry to record the funding, if you will, coming from the county, unless you're saying we're going to take the $1 million out of the capital plan.
That's what I'm saying.
And provide zero.
I'm asking is we could do it either way. We could put it in the capital improvement plan like you have, the $1 million, or we could take the $1 million and put it, and we could put $4.4 million in capital outlay for Martha T. Berry.
Correct. Then the general fund support becomes a question. But you're correct, from an accounting perspective, we can do it either way. Correct.
That way, Martha T. Berry is then responsible for handling the repairs, keeping the county out of it totally, theoretically, right? Whether they want to use F&O or not, that I would assume they would. But I'm just talking out loud here. So they would have then the money to spend, rather than us put it into the big bucket, and when that's moved, I think for us identifying, do we want to do it one way or the other ways, and I'm talking out loud here because we've never done it, we've never made a capital improvement for them specifically. So I try and always look at, we're making these capital improvements in these funds, what are we really spending it on? And then when we bury it in a capital improvement fund and never knowing what we put in there, but Kevin will always know. If it's in his budget, he knows what he got, what he spent it on. So I guess the question then comes to is that we, like Commissioner Hall said earlier, we're $3.5 million approximately short based on what Kevin's needs are and his capital needs.
And I can tell you what we did at another facility, actually at 2 facilities. We had a restricted fund that the treasurer managed that was discrete and independent. And then I would bring a transmittal to the county commission and say, this is what I'd like to spend it on, and get approval from the board for it.
Yeah, it's similar to what we talked about, I think, in previous years, where if we were going to give you specific funds, that was actually one of my suggestions, is we put it in a restricted fund specific to that purpose. And it can only be drawn on for that specific purpose.
Right, and it might be a little different because the buildings themselves are underneath the executive office here, so we'd have to talk about how that process would work. But that has worked in other counties pretty successfully, because it's, that money is going only to your building and not getting bled out for operations or anything like that.
Okay.
And
I think we need to look at the JOA. Maybe council or corporate council can just clarify that, just so that we're doing it the right way. And if this is the first time we are doing it in this manner, we should be
Yeah, and I
following the
would
JOA.
say to you, Commissioner Sabatini, that I think at the end of the day, the capital expense would end up being recorded on the books of Martha T. Berry. I think what we're talking about is how much are we going to fund, how are we going to record that expense on the county side. It's truly an expense that needs to be recorded
on their
the books of Martha T. Berry.
Correct.
It's on the plan, so everybody knows that we've identified some funding that we think we can provide to them.
Yep.
So we can take the accounting afterwards is
okay.
Not difficult.
Perfect. Thank you, Chair.
Commissioner Kraft.
Thank you, Madam Chair. I'm going to have a couple of questions for both of you, but Kevin, I want to start with you since you're there. Over the years, I've been incredibly supportive of Martha T. Berry. My votes may not reflect that, but that's not based on it's based on the means, not necessarily the end. You know, Kevin and I, we've always talked about trying to find the solutions to funding the problems, whether it was, you know, through the millage, how I didn't agree doing it that way because we had another set of funds that probably could have been used for that same purpose. So again, we agree on the same end. And with this, I have a question about your capital outlay line item in the budget. In 2020, there's a 0. In 2021, there's 142,000, and then after that, it hovers around 600,000.
Sure.
What's that change? And I'm looking at the total picture here. So $600,000 a year, even with the $1 million, you still can't purchase. Maybe you can get the HVA and part of the C with that. Where did those numbers come from, and why did they change so much?
Sure. Well, in 2020, we had just completed the large cap item, and those are actual numbers, by the way. So every dollar went to COVID at that point, and we knew we couldn't get vendors even to come in. I've got a broken glass window that still is 2 years out that the vendor still won't come in to repair because he's paranoid of COVID. So those were kind of things that were happening in 2020. So the 600,000 that we put in because we know that we need to maintain the building, but we have no mechanism until we cleared the building use agreement, and we're still not clear of it because of COVID. But until we clear that, there's no way we could start doing any large cap items. And the only reason I did come here is, you know, as Steve said, we have not asked for any general fund money since 2009. I think it's 13 years. You know, but nobody could have anticipated how much that OPEB, you know, would hurt us. And now we've got the opportunity to have some other funds. But I also understand you can't spend the same dollar twice on the ARPA fund. So I'm just asking for any help you can be in this way.
And you said with the building use funds, once that's cleared out, you said you want to start a sinking fund for projects and third that.
Yes.
When do you expect, or when do you think you'll be able to pay that off?
I'm anticipating it won't go any longer than third quarter of next year. Okay. Right. I think I've made 2 payments on it so far out of 10. I do want to, again, I want to be a good, you know, a good partner at the table, and it doesn't mean that, you know. I wish I could take care of it right now. I just can't do it. So everything else is going well, except those legacy costs are really, really devastating.
So once you clear that, what's the estimate that you'd be able to put in a sinking fund, say, you know, per year?
Once that's clear, I should start being able to, in addition to the 600,000, put around 700,000, 500,000 to 700,000 a year into a sinking fund. That as you know, as needs arise, we'd be able to pull that out. Okay. My hope is to have, you know, if you funded those 2 items, then I could start funding it in 2024, and that'd be a huge help for me. If you fund all of it, you know, I can start funding it. It'd be incredibly helpful. And I know that I'd still, by the time I retired, which God willing and my wife willing, it'll be 8 years. So
thanks, Kevin.
My bride wants me to retire earlier.
Thank you, Kevin. Yeah. Steve, quick question for you about this idea of transferring money from the general fund to the capital plan. So we throw a dollar amount out there to cover let's theoretically. Can that money be designated to those specific projects, or is it just money dumped from GF to capital plan?
We would specify it to specific projects.
Who's we?
Administration, between myself and the exec's office. Kevin's identified 4 projects that he would prefer funding for, or like funding for.
Right.
We would put each of those 4 projects on the capital plan and identify dollars toward each project.
Okay, but we as the board can only transfer the funds.
Correct.
Okay. Thank you, Steve. Thank you, Kevin. Thank you, Madam Chair.
Thank you. Commissioner Farrington?
Thank you, Chair. Kevin, welcome. First of all, I want to thank Commissioner Sabatini because looking at the different mechanisms of how to fund this so that we have some control is a good conversation. I just want to look at it from a different perspective to put it out there. So the PTAC, the boiler, the electrical, let's say we take care of HVAC, all 4 letters. How critical are the other 3 and in what order are they critical?
They are actually in order of importance. We did have some recent issues with our boilers, so we're actually, we negotiated with the vendor to slow bill us for it, but we have to get the boilers in place because we did have we had a failure.
So really that's already number 2.
It already is, yeah. HVAC, the PTACs, the ones that we have right now are now past their useful life, and we are cannibalizing from our dining rooms to make sure they stay in the resident rooms because they don't make that anymore, and the manufacturer that we had ordered some from a year and a half ago went out of business. So without recourse.
So HVAC is 1, boiler 2, PTAC 3.
Yep.
And
electric switch and panel upgrades, we're continuing to work with F&O on that from, as we're able to from time to time. They're going to be doing
so
some
that's
things
not a
on
one-time thing, that's continual.
It is.
Okay.
We could do it one time if we did that, but we can manage it because they're working on the power plant for the morgue and the jail right now, and some of that is a pass-through. Our building physically is getting passed through some of that power to some of those areas, so we're working on some of the switches there.
Okay, just throw a few numbers out. You'd mentioned about $600,000 a year on the OPEB because you get reimbursed by the state based on your expenses.
Right.
Over the 13 years, that's $7.8 million. So if we as a county, and I'm not blaming anybody here, but we as a county did the JOA differently, he would have had plenty of money to pay for all this because that's $7.8 million. Secondly, when I look at, I'm not attacking one program, but it is the largest. Just to do the HVAC, the additional $800,000, when you look at what we're doing for the jail intake of $117.9 million, it comes to 0.7%. That's not even a rounding error, people. To go back to the project on the jail and go, you can't find 0.7%. I think we should go back to purchasing because, if it comes down to it, if we don't want to take money elsewhere, to me that's a no-brainer when it comes to budgeting. I mean, I don't think they got it nailed down to 0.7%. So I just wanted to do that. A full request would only be 3% of what the jail intake is. So just want to let you know that this seems pretty critical. I don't think it's people not understanding GOA. I think it's different perspectives of what Kevin thinks, what the executive's office thinks. And we just got to figure out how to make it all work. So at a minimum, I'd like to do the HVAC. If we can do more, I'd appreciate it. Thank you.
Thank you.
Commissioner Kleinfeld.
Thank you, Chair Steve. All this discussion has got me thinking, we don't have the ARP funds in the general budget, right?
Correct.
So, and you had said, and we've had this discussion before, we don't vote on capital outlay, is your position, right?
From a budgetary standpoint,
From
correct.
a budgetary standpoint.
Right, you vote on the contracts to fund those capital projects.
Right, but the ARP funds have been plugged into that capital outlay, correct?
Correct.
Which means it is the executive's position that we cannot use any of the ARP funds to transfer anywhere because you've put it in a part of the budget that we can't touch. Is that correct?
They're non-budgeted funds, correct.
And just so everybody knows, that came about at the very beginning. There was some sort of agreement with the board where the board said, well, we won't control the capital outlay. We'll just do the rest of the budget. I'm not sure how that came about. But when I came on, I said, when you're an oversight body, the number one thing you look out for is construction. It's the number one thing because it's the thing that could blow up and could get your government entity in financial distress. So when that money came in, it didn't have to be plugged right into capital outlay. It was plugged into capital outlay so that it wouldn't be in an area of the budget that we would have any say-so on it. Would you say that's correct?
No. I would say it was plugged in where it was plugged in because the projects you've been hearing about were identified as priorities of the exec's office.
Because the priorities of the exec's office with regard to the ARP funds were all in an area of the budget capital outlay that the rest of us would not have any say-so on from a budgetary standpoint. Correct. So we can't use ARP funds according to them. I don't know legally how that all plays out to get a windfall from the government and it gets put into an area where their position is that we can't touch it. I think that's fascinating. I don't know legally where that position came from. And I understand why the executive put it in there. He has plans for that money.
Correct.
We didn't want to use general fund money because there's ARP funds, and we never got to have a discussion. We talked about when we heard about these ARP funds, board members wanted to have like a workshop where we could discuss with the county executive what the plans were, as opposed to the county executive just saying, here, this is how we're spending the money, no discussion. But now that it's been plugged into that area of the budget, that's the position, no discussion. So the only way that we can do it now is from general fund money, correct?
In terms of
giving him that
correct.
Money.
Yeah,
from your perspective.
Here yeah, from where we stand here today, yes.
Okay, and so these essential workers that we were able to cover with this COVID relief money that was able to free us up money, sort of like we just came up with over $500,000 for an item in the morgue. Could his employees have fallen under that essential worker? Same deal?
Yes. Are you talking about the portion of the ARP funds that could be allocated to bonuses, or are you talking about the CARES Act money?
I'm talking about CARES, because that's
CARES
really
Act?
where the savings came from, right?
Primarily, yes.
Yeah.
And so we did provide about $8 million of CARES money to Kevin to support his operations during the pandemic.
Was that to support the caps and gowns and gloves and all of that, or was that to
we did provide some payroll reimbursement, as I recall, as well.
Yes, that's correct. We did for the first 2 years.
We did.
Yes, but not this year.
And we couldn't because the CARES money was.
And by doing that, that didn't give you the opportunity to bank money from that?
No, we were. If you took a look at our expenses, they weren't that much lower than the year before, but our census was low. We were trying to keep people in place, so we were giving bonuses and meals. We were paying gas cards for people to get to work. We were getting lifts to get people to work. So, so we were buying PPE. We had to buy equipment for all the monitoring that we had to do. We had to get a new software program to get 350 people on it to do daily monitoring of their health and record to National Health Safety Network in the state of Michigan.
All right. All right. Anyway, I just thought it was important for the board to know where their position is on those ARP funds. Thank you.
Commissioner Sabatini.
Thank you, Chair. Kevin, in regards to the amounts for those capital improvement expenditures, have you bid those out already? Is that where you've come to that price point?
No,
you're guessing?
Commissioner Sabatini, what's happening right now is we asked for a ballpark figure from our vendors that we currently work with because they won't do a quote because we don't have the money for it. So they will not give us a firm bid until we can commit to it.
So that's
So
my
it's a chicken
concern
and egg
because,
issue.
you know, we're having a lot of issues right now with bids changing drastically because of what's going on. You know, I don't want to say that your amount is truly 4.5 million. It may be 5.5 million when you get to that point. So, you know, just thinking through this,
Sure.
you know, maybe there is, I think we need to think through what specifically the needs are, which we know what they are, and truly how you can get a bid realistically that we can then grant you those funds, because you're then going to have to come back to this board if you're short. And I don't want you to have to do that,
yes.
but I also want to make sure that your needs are met.
Right. I appreciate that, Commissioner. My expectation would be that whatever, again, because this is all new, I do want to be, you know, a good team player.
Mhm.
So if you only have a certain amount to provide me, if you put that in there, and let's say you put the 4.4 in there, and then I was only able to fund the first 3, you know, because of cost increases, then that's where it's at. And then I'd have to figure out how I get the electrical panels and upgrades going. So that was kind of a mindset that I had if you wanted to set the money aside for us. Again, because it's so uncertain, I'm guessing you probably heard from F&O or for other departments, they're having the same challenges on bidding. So,
Yeah.
But
If they can even get a contractor to do the work.
Exactly. So I do have contractors in-house that we work with, you know, that we have pretty consistent relationships with. And they said, as soon as you're able to, I can get you a firm price, but I can't give them a firm price unless I have a commitment on cash.
Okay. Thank you, Chair.
There's a couple things to make sure we understand. Kevin, what are you paying rent?
I don't pay rent. We have a building use agreement that is up this year. So I was required, and it essentially was trying to be in line with the bond that was in for about 20 years for improvements in there. In addition, I do all of the repairs during that time too. So that's where when we're talking about it, you know, as if it's a renter situation, it's the worst tenant landlord I've ever been, because I have to pay rent and then I have to do my own repairs. So I'm getting double dipped on that. But
But don't you pay something yearly?
it's done this year because of the building use agreement, and then we have to mutually agree upon that. And actually, the executive office is working with our attorney to say, you know, according to that section of the building use agreement, there's going to be no more additional charges. Is that accurate?
Yeah.
Well, that's good.
Right, yes. So, so after this, as soon as I can pay that off, which is probably third quarter next year, I won't have any building use agreement, but I'm still required to provide for the building.
Right, so I think, was that $100,000?
It was up roughly, no, it was roughly $900,000. I think it's
900.
889 this year or something like that. Steve, how close?
$1 million, and you got $1.8 million for each suite, right?
All right, so that will be done. That'll be helpful. The boiler, I don't see how we cannot take care of these, because if the boiler goes, what if you don't have parts? What if it's winter? I mean, this isn't enough. You have to get all these things done, and we're going to have to find a way to do it. Several people have said that, and I absolutely agree with it. A couple of these, this HVAC and PTAC, is that a state requirement to have them? I mean, could the state come in there and check that, or not?
They do. There are temperature requirements and there are airflow requirements that we're supposed to have. And the reason that HVAC is at the top is that the CDC has made recommendations to upgrade to air handling, air scrubbing units that we currently don't have. And we know that every time they make a recommendation, it becomes a policy at some point.
Right.
And when that becomes a policy, you know, if you've worked in healthcare, you know, once it becomes that, the price shoots up significantly. So we're hoping to get in front of that by getting that locked in soon. So they want the ultraviolet management, they want air handling, they want upgraded filters, and they want more airflow going through.
Yeah, and if they have they sanctioned you yet or not?
No.
But if they come in to sanction you, that's more money, and it has to be done immediately,
Right.
and that's a whole nightmare.
Right.
So he's been before us with this in this last year. So these are major situations. The HVAC for the whatever, and then the PTAC goes in the room, so the citizens have air, clean air. To me, it seems like Martha T. Berry's teetering on a cliff. Wind blows, and then the situation, it has to be handled. It is uncomprehendable to me that Martha T. Berry is in this situation. It is absolutely wrong. And this just has to be resolved, and soon. Not till next year. It really has to be resolved, and I'm glad that there are several commissioners that are very, going along with this. I think about it regularly because I know it's just a terrible, terrible situation. Yeah. The workers are great. Kevin, if you didn't have somebody of his caliber, I don't think it would even be running at all. So this just has to be done. Thank you. Commissioner Van Sickle.
Thank you, Chair. Just real quick, how many people are in residence right now?
We're currently serving 185.
And if you had no restrictions, what's the total building?
217.
217.
Yeah, we're the 13th largest in the state.
Thank you. Thank you, Chair.
I think we will take a vote now. We've covered everything. We're going to add the budget onto the amendment, onto the receive and file that we had before. We'll take the vote now, please.
6B and 6-7.
Madam Chair, Commissioners, thank you for listening. Thank you for caring. I'm most grateful for the conversation. Thank you.
Motion passes 10-0.
Thank you. We are going into public participation. Participation for anyone who wants to speak on any thing that they want to speak on. Once, twice, passed.
I'll make a motion to adjourn.
We have commissioner comments. Who would like to? Would anyone like to say anything? Let me get over here. I will say one thing that somebody brought to my attention. I guess other states are doing this, and it's been passed in Michigan. I had to look it up because I didn't see it on the news. In our elections in Macomb County, for the mail-ins, because there's so many, they're taking the outside sleeve off the mail-in part of it. They're opening and removing those, but I guess the rest of them are supposed to be secure. They're not taking the inside sleeve off, and so to help with counting. I wish they would just leave everything together if it's 1 or 2 days later after the day of election for integrity, but I don't know how many people feel that way. And now we will go to
motion to adjourn.
We're voting. Because Mr. Romano is not here. Thank you.
Motion passes 10-0.